We got completely shut down in March, as many businesses did. The very first person there was Carlene Dotson from SBDC. Maybe this does last 12 months. Maybe those funds we saved does all go away, and that really hurts and that sucks. But I know they're going to be advocating for us, and I know if I need help, they're just a phone call away. So having that person to look to, even if maybe they didn't have all the answers, they gave us the freedom to do what we do best, which is provide value in health and fitness to our customers.
The biggest challenge was in the very beginning when the pandemic hit, and just the unknowns of how to manage the protocols and the laws that were coming down from the governor and the lieutenant governor.
We had Zoom meetings, and questions would go up, and then many mayors would ask questions, and the rest of us would sit and listen, and then a mayor would come up, well, this is what we have tried. And it may have been something that you have never even thought of. So it may be a good idea that you can apply in your community.
The ongoing meetings and interacting with my peers when questions come up, whether it's COVID related or not, I can get questions answered anytime I need to. They hosted weekly online gatherings, which were informal, and we could just have an open exchange with each other. And that helped, I think, all of us to know where we stood, share problems, find solutions together, and get peer support that everybody really needed.
The Mayor's Partnership for Progress really fills a gap. And that gap is providing technical assistance, increased capacity to help them advance and basically come out of this pandemic stronger than ever before.
The pandemic has increased the risk for many people in terms of suicide. And so at a time where it's very, people are isolated and having to stay inside and not see their family and friends as much, that increases the risk.
The Strengthening and Sustaining Ohio Suicide Prevention Coalition's initiative allowed 17 of Ohio's suicide prevention coalitions to engage in activities to enhance their coalition capacity.
To be part of this grant process helped us get the groundwork in place to really have a data-driven strategic plan that involved input from the community.
The goal of this initiative is to develop Ohio suicide prevention coalitions so that they are using effective evidence-based strategies in their communities to reduce suicide that are culturally relevant and sustainable.